I love to see my patients with a new smile and renewed confidence. To be fair, I don't see the patients that often. Most of my contact is with the patients over the phone, but we do build up a fantastic relationship, and I can actually hear the difference from the first time they phone up, nervous about treatment, not quite sure what to expect, and then we go through a journey together, and they just sound so relieved, happy, confident. You can really tell a difference when you speak to a patient after the treatment. Most, in fact, all of our patients' stories are memorable and emotional for pretty much the same reason throughout. Most patients have come to us because the thoughts of continuing their lives as is, with wearing a denture or teeth that they're embarrassed of or conscious of, is no longer a possibility. What we do enables those patients to live their life again as though they'd never had to wear a denture or never had teeth that they were ashamed or embarrassed of, and it really does make all the difference. Patients tend to have been quite unhappy with their teeth for a long time before they find same-day smiles. With the internet these days, everyone knows how to Google search. People search for loose dentures, permanent teeth in a day, anything really to help them get out of the situation that they're in now with the teeth. They can either email me through our Same Day Smiles website, or they can give me a ring, and I'm happy to spend as much time chatting to that patient as they need. Most patients who come to us are so nervous, either through bad experiences previously, which have prevented them going to the dentist, or for whatever reason they do tend to be a little bit nervous about dental treatment. So it's my job really to get that initial conversation out of the way. A patient's taken the biggest step by contacting us, and it's a case of rolling with it from then. I talk to patients every day who have been out of dental care for decades, some of our patients. So it's not a quick thing, it's not a quick fix, and it is something that patients do want to talk to us about and find out a little bit more about the treatment and what they can expect for it before they even set foot in our dental surgery. Once they're comfortable with the idea of the treatment and happy with the experience of our dentists and the quality of the product that we provide, the patient can then go for a free consultation at one of our practices, and the dentist will have a look, have a chat, explain all the possible options to that patient so they know what can be done for them. It's no pressure at all. We're not about pressuring people, we're not about rushing people. We want to know that we're providing the right treatment for the right person. After the consultation, if the patient still is interested in going ahead with the treatment, we would then organise a CT scan for them. We want to know exactly what is involved in the treatment before the patient comes anywhere near a surgery, and we plan meticulously everything that we're going to do for that patient. Only when we've finished planning and we're happy that we can do the treatment and that we can do it well, we will then give the patient a document that explains everything that's going to happen. Again, only when the patient is happy with that document and understands everything, which is what I'm here for, and also the dentist. If the patient wants to talk through with me, to talk through any questions or worries or queries about the treatment, that's absolutely fine, that's what I'm here for. Equally, if they were more comfortable going in and having another chat with the dentist about it, we can do that as well. We just want a patient who's comfortable and happy about what they're going to have done. Once they decide to go ahead, it's pretty straightforward. We just need to take some impressions of the mouth, some photographs, some measurements, really quite straightforward. And then a couple of weeks after that, the surgical procedure goes ahead. The patient comes in the morning, either with dentures or teeth that are not brilliant. So by the time the patient leaves the surgery, when they've had the procedure completed, they're going away with a beautiful smile and a fixed set of teeth. We then see the patient regularly for reviews throughout the time that the implants themselves are healing, so that by the end of about 4 to 6 months usually, we can then start the process of making the final set of teeth for the patient. The first set they have are a test drive, a prototype. We can adjust them throughout the healing phase so that by the time the patient's going to get the final set of teeth, they are perfect. They are what the patient wants, they'll function correctly, they'll look beautiful. The second bridge of teeth that we fit, we call it the definitive bridge of teeth. It's actually reinforced with a titanium framework, which means that the patient can go back to eating whatever they like. They can crunch juicy apples, they can chew steaks. It's as though they've got their own healthy set of teeth back. Some patients are so nervous about the surgery that they do need a little bit of help on surgical day to relax. We can help. We can provide sedation, we can make it as comfortable as possible for the patients. Some of our patients find it really helpful to speak to somebody that's had the treatment done before, so they know from first-hand experience what a patient goes through, the journey that they've taken, and how it feels after the surgery as well. People want to know what to expect, and we want to give an honest answer. We want the patients to know what is going to happen and what the outcome is going to be. Information helps you to relax. It's usually quite emotional. We do get a lot of tears of joy, but the benefits are more long-lived than that, really. It's not something that's going to keep you happy and keep you smiling for a week. It's a knock-on effect. It lasts a lifetime. It makes a difference to people's confidence, rather than live with the embarrassment and the self-consciousness of having teeth that they're just not happy with. I love to hear from patients who have found a new inner confidence that's letting them enjoy a social life again. The amount of patients who won't go out for a meal with friends and family because they're worried about dentures. They don't have to worry about dentures anymore. If you want to be able to live your life with confidence again, just do it. I'm so lucky to work for Same Day Smiles. We do something that helps people. It helps them to be happy, it helps them to be confident, and I'm so fortunate to be able to be a part of that. But it helps the families as well. You know, if you're living with a person who's not happy, for whatever reason, it might be the teeth, it could be anything, but to live with a person who's not happy and who's not confident is hard. So being able to help individuals and their families, not just today, but for the rest of their lives, it's amazing.